All right. Well, good morning, everyone. Thank you very much for being on this call this morning. It is a wonderful Monday morning here at Health Plan Markets. It is August 15th, 9:02 a.m., and we are here to improve the lives of our community with affordable health care. So thank you for being a part of that mission. And thank you for being here so you can get the latest and greatest updates, the news, breaking news, and things that you can use here at Health Plan Markets. So, first thing is we got to know what we're talking about, and we've got some events coming up this week, and I want to make sure that everybody's aware of these events. And then we also have a couple of announcements as well. So let's dive in here. Just as a reminder, these calls are being recorded, and as we get into AEP, if you find yourself, um, you know, deciding whether to be on this call or to serve a client, please always know that clients come first. And these calls are being recorded, so you can come back and check out our YouTube channel. Make sure you go out there and subscribe to our YouTube channel if you haven't already. And that is how you're going to get these calls as well. Also, I noticed that some of you are calling in. You're definitely going to get more out of this call if you have a computer connection, because I am going to show my screen. So just as a reminder, uh, it's better to log in through your computer so you can actually see what I'm talking about here. So with that, let's dive into training. So this week on the training calendar, not much else going on this today, but tomorrow, Tuesday the 16th at 10 o'clock, Aetna is doing their product training in person at Centerwell. That's on the West Colonial Drive. So I know that Mr. Angel Suarez will be there. Aetna is coming out with some really awesome plans for next year, so you're probably going to want to see that. And again, a lot of these trainings may be geared for the Central Florida market. If you're not in Central Florida, don't panic. There is a training link I'm going to share with you guys later on how to find all the rollout sessions in your area as well. Cigna at 11 o'clock tomorrow, they're going to be at the Bahama Breeze in the Tampa market. So they're doing their kickoff 11 o'clock tomorrow at the Bahama Breeze on Rocky Point. Also tomorrow at 11, Devoted is doing an open training session for all you newbies that have not yet been brainwashed by Devoted. They're doing a session tomorrow at 11 o'clock. Also tomorrow, 2 o'clock, Cigna's doing another kickoff. This one's in Daytona at the Autograph Collection Hotel. Really nice hotel, by the way. That's at 2 o'clock tomorrow. 3 o'clock tomorrow, Humana's doing an Orlando plans rollout. That's at 3 o'clock tomorrow. And then 4 o'clock, Cigna's doing a kickoff as well at 4 o'clock tomorrow at the Top Golf in Orlando. So it looks like Cigna's doing 3 different kickoffs in 3 different markets tomorrow, and we're going to find that to be the case. So again, I'm going to share with you guys how to get to your kickoffs, how to get to your rollouts in your sessions or in your area so you can find a session that makes sense for you. Moving over to Wednesday, the 17th, UHC is doing a rollout session at the Sheraton over in Maitland. That's from 10 to 12 on Wednesday. Also at 10 o'clock, Horizon is doing a management team virtual training there. So you can check that out. That's at 10 o'clock on Wednesday. And then also on Wednesday, the big one, Freedom's doing a rollout session for the Tampa market, 11 a.m. to 4 p.m. That's a long one, but that is there. You do need to RSVP. I recommend RSVPing for all of these events, but this one specifically, they will turn you away if you're not RSVP'd. Phone numbers in the training calendar, so check that out. Thursday, 9 o'clock, Devoted's doing a rollout in the Villages, up there in the Villages at the Glenview Country Club. Check that out, 9 o'clock on Thursday. That's early. Also on Thursday at 11, Cigna's doing a kickoff at the Bahama Breeze again. Looks like they're doing at the same time in Melbourne. So 11 o'clock at either the Tampa Market Bahama Breeze or in Melbourne at the Courtyard Marriott. So those 2 kickoffs are happening. And then Devoted's doing their coffee and chat session at 11:30 on Thursday. So if you want to jump on that call, you can. Nothing going on Friday, but those are good days to continue your certifications. So if you haven't done your certifications, this is a fantastic time to get that stuff done, and then jump over to a rollout session so you can learn more. So we'll talk more on that, on how that looks. All right. Another event I want to make sure everyone's aware of is our kickoff. We're doing a kickoff on September 8th at the Studio Movie Grill in Kissimmee. It's a brand new movie theater slash restaurant slash bar slash hangout place. So we're going to do our kickoff there. That's September 8th at the Studio Movie Grill in Kissimmee, and that'll be at 2 p.m. We're doing a little bit early so you guys can beat some traffic. 2 p.m. there. We are going to have updates. We've got some sponsors that are going to be there. Got some really great industry updates, and we want to share with you what we plan on doing for AEP 23 and beyond, giving you guys a quick update on what's going on with HPM. We got free food, snacks, drinks, dessert, all that stuff is going to be there. No one will leave empty-handed. I can guarantee you that. We've got lots of door prizes, giveaways, raffles, all sorts of fun stuff to be there. So please make sure that you RSVP if you haven't. This is the website. You've been sent an email and text message. If you haven't, just reach out to a team member, and we are glad to RSVP you for this event as well. We should get done around 5 o'clock, but there is going to be a little bit of an after party. So, if you want to block off the rest of the afternoon, go for it. We'd love to have you there. So far, we have Centerwell, we have Direct Mailer, and we have United Healthcare as well as Humana that have confirmed their attendance as well. So we're going to have providers, we're going to have a marketing company there, and we're going to have some carriers as well. So, please come hungry and ready to leave with lots of good stuff. So again, that's September 8th, 2 p.m. If you don't have the info, just reach out to a team member, and we're glad to get you where you need to go. All right. So let's jump over to the gold key. And yes, I've been talking about this a lot. It's our theme for this year. Just want to share with you a couple of updates that I've got in here. The first thing that you'll see is up top. AEP 23 is almost here. Get prepared here. And so I found a great resource with Humana. And on this resource, when you click it, hopefully it'll take you, there it is. It'll take you to their AEP 23 journey. And they've got some great guides that talk about their neighborhood centers, all the first looks for Humana, all the academies, certification, recertification, and just some general information as well in gearing up for AEP 23. So, take a look at that resource. I think it's really, really great. Very, very well thought out and organized. But I thought this would really help you guys as well, as you're preparing for AEP here. So that's right up top there. Diving into a couple of things that I wanted to make you guys aware of, in case you haven't been, is many of you are looking for SEPs. And so as I'm finding these SEPs, they are specific to the carriers. So for instance, with WellCare, they have a specific SEP for specific areas. So jump in here if you're looking for an SEP, if you've got a client that unfortunately doesn't have, is not interested in a 5-star, doesn't have Medicaid or any of that stuff. There are designated SEPs available, and it is per carrier. Not every carrier accepts every SEP, so that's why it's designated per carrier. So for instance, when you click Cigna, you'll see in Florida, there is an SEP in Bay, Calhoun, and Gulf areas for Cigna. So if you sell in those areas, so there it is. And then if you open up Humana, they've got the full list there. The SEP notice is a link, which makes it pretty easy. So you can click there and it'll take you, and they keep that pretty much up to date. It's a downloadable PDF. And so, that one was last updated on July 7th, but it just keeps you up to date as far as the SEPs are concerned. So just want to make sure that you have that in your back pocket. But also we've really been building out the knowledge centers and such. Before I dive into that, I want to share with you the first looks. Again, we talked about this before. Here's all the first looks, the ones that we're receiving. They are designated by carrier. Some of them are websites, some of them are PDFs. So just find the one that you're looking for, and then you can grab the information from there. The rollout sessions, as I mentioned earlier in the call, these are the known rollout sessions that we have found or have been sent to us. Some rollout sessions also are in your email. but go ahead and click these links. Some of them have a really nice rollout page like Simply, and they're always updating it. Devoted's got a really great one too. So you can find the rollout sessions in your area. All right, let's go over to the training area. This is the learning center that we've been building out. There are carrier trainings, and we've got our webinars rolling. We've got our training calendar, as we saw this morning. Spark Advisors, our partner, has their training calendar, and you can click on that as well. But we found some really great things like how to properly compare an MAPD plan, election periods, MA versus supplements, the sales process. I've built out some call recording examples. If you're thinking about upping your game, how do I get leads and sales using the telephone? Got some stuff there. Phone etiquette 101, some scripts that are really helpful, some examples on YouTube that I found, all sorts of great stuff there. Humana's got some really great pieces as far as guides for social media. So we've got a social media department here that we're kind of building out, and a training on deck as well. So Learning Center is getting built. This is how we continue to improve ourselves. So a self-sustaining ecosystem, if you will. So please pay attention to that as we go forward. I know you guys have lots of certifications and recertifications to go through, but I'm finding that some of you are asking some pretty basic stuff that probably should know about, and I'm going to lean you into these training decks so you can go in there and learn. Another thing that we're building is the marketing assets that will be ready and available to use. One that really stuck out to me is Humana's Marketing Resource Center. And they've got, again, some great PDFs and guides there. But when you click that resource center, it'll take you over to Humana's, basically their marketing department for us agents. And you can go into your portal. It walks you through on how to go in there and create your own marketing pieces. So, you're not leaning on anybody. They do have some upcoming trainings on their MRC. So you can get in there. They've got a quick video on how to work all that stuff, so that's there too. One thing I do like about Humana is they did create a already usable 101 educational 101 presentation. And you can find that. It's a video, and it's 5 minutes long. It's really not that long. And you can find that, I believe we put it under events. And there it is. So there you've got, if you want to do a presentation to a client, Medicare 101, or if you want to build your own, they do have the decks available, and they are generic, but it is branded with the carrier information. So we'll have those available as well. So you have the Medicare 101 presentation. You have a video here too, so you can deep dive with your clients. Or if you want to do events, one of the biggest things that you can do right now for yourself is go out there and create seminars out at 55 plus communities, senior centers. Go to them and say, hey, I'm not here to sell anything. I'm here to teach you about Medicare. Okay. Then you become a resource. Then you become an expert. Okay. Another great thing is, hey, I'm not here to sell you anything. I'm here to help you apply for extra help. I'm here to help you get LIS, low income subsidy for your prescription drugs. I can save you up to 95% of the cost of your medications. Or I'm here to help you apply for Medicaid. And the thing about it is you've got to be consistent with it, right? Continue to go to the same places once a month, continue to reach out to them. And a lot of these apartment complexes and senior centers are required for their contract to do a specific number of events every month. And some of them, they have to do one for health, and they have to do one for whatever. So when you talk to them, let them know that, hey, I know that you guys have a requirement to complete some of these events as a senior facility. So go in there as an educator, and I guarantee you will get leads. Okay, just naturally progresses in that fashion. So, some great resources. Let us know what you need so we can get it out to you. Some of them, and we're on the event page here. So just as a reminder here, going into this right here, events need to be filed. All events regarding Medicare need to be filed, educational or not. They all need to be filed. Okay, so we do have our file form here right up top under events. And then there's some carrier guidance as well. So if you're doing one specifically with Devoted, they've got an entire instruction that we've loaded in here for you too. If you're doing for Freedom, they have a specific event change form and all the information necessary in order to complete an event with Freedom. And then Clever Care is another one. They've got an event request form. So as we're getting all of these different event guidance, we're going to load them in here. But just know that all of your events do need to be filed with the carriers, at least somewhere with CMS, and we'll help you do that. So just keep us in the loop there as well. Another one is the contests and bonuses section here. There are lots of contests going on. Want to point out the newest one here is from Aetna, and Aetna is reimbursing or co-oping with 30 agents for AEP for your Walmart. So some of you have purchased a Walmart store. This is first come, first serve. I'm going to go ahead and read this. It says, in order to qualify for the reimbursement, the agent must commit to 20 plus AEP sales for Aetna. This is for all Aetna MAPD products using the AEP election code for a 1/1/23 start date. Okay, so if you're committing to 20 Aetna enrollments, if you know you're going to do 20 Aetna enrollments, they will reimburse your cost for Walmart. Okay, pretty cool, right? You just need to provide a receipt that you paid the Walmart store. We've co-opted with you, so some of you have paid $750. So you just show me a receipt, and then your W-9 form, you got to send that in with your EFT so they can drop it in there as well. So that is good to go. So if you're going to commit to 20 apps with Aetna, you feel pretty good about that. They'll go ahead and reimburse that Walmart for you. Just know that it is only available for up to 30 agents. Okay, 30, which is not a lot. All right, so get in there early and get your Walmart paid for. Another one is Cigna. Just go out and do your certification and they enter you into the raffle that they got going on. That ends on August 31st. So you got about 2 weeks to finish your Cigna certification. They're giving away AirPods, Bluetooth speakers, coolers, Yeti cups, really fun stuff. So if you've already done your RTS, you're automatically entered to win. So very, very cool. Really glad to see that some of these carriers are rolling out some bonuses and contests as well. Okay, let's see here. AEP is coming, and we really need to gear up for your book of business. So if you have a book of business and you typically do a campaign out to your book of business, you do a letter or a postcard. Some of you do that. Others lean on us to get that done. And this year, we're working with Spark to get that loaded and out to your clients. Okay. So what you need to do first, if you haven't yet done this, is you need to get your book of business in order. You need to get it organized, and you need to get it on the Spark platform. Many of you have started the process, but you haven't uploaded your book of business. Please follow through on that because you are running out of daylight. Okay. They are going to cease the AEP campaigns in early September. So please make sure that you get this rolling now. One thing that you can do is from the Gold Key, the Spark platform, you click Spark platform, getting started, watch the webinar if you haven't already. You're going to sign the terms and conditions. Go ahead and read that and sign it. And then you're going to upload your book of business and they'll walk you through on how to do that. There's a flyer there that helps out as well. If you do need some support and guidance, you can email Spark Advisors or jump on John Mullen's calendar. John is the trainer for the Spark platform there. This is your customer experience platform. You need to load your book of business there so they can mail the postcards out and create the survey for you. Okay. What this is you're going to get a postcard made with your picture, your name, and your phone number on it. And it's going to say, hey, Justin, it's that time of year again. AEP is almost here. I need you to do a quick survey for me. Then that goes out into the mail. The member either scans it or calls the member support, right? And they do the survey over the phone or they do it online. And in that survey, they're going to ask them one question. Are you happy with your health plan? If the answer is yes, Great. They notate that, and you know that you don't need to reach out to that member in AEP. They're happy. Maybe reach out and say, hey, I'm here in case you have any questions. So that's going to streamline your efforts. All the people that indicate, no, I'm not happy with my plan, then it opens up a questionnaire. And that questionnaire is, what plan do you have now? And what we've loaded in the CRM, they're going to see whether it's accurate or not. What's your address and phone number? It's gonna automatically pre-populate that to make sure that their address and phone number is correct. So if they moved, they can update it right there in your CRM system. Amazing, right? And then it's going to ask them, are your drugs and doctors, can you upload those? And so all that information is getting collected and updating your CRM system so you have the most rich and fresh data on your clients, okay? So it does that. And then you're going to get a report at the end of the campaign that says, hey, you sent out 100 postcards. 50 people said that they were happy. The other 50 said they're not happy. These are the people that you need to go see from October 1 to October 15. Okay. So those of you with a book of business, I hope that makes a lot of sense. And it's really going to cut down on your back and forth and your expenses as well, which we're going to talk about in a minute. Although all those of you that don't really have a book of business, that's fine, okay? But this is why we report our applications. This is why we use HPM Shop, or what's now called Medicare Shop, to do your enrollments, because all that information, we're finding that some of you were doing paper applications or using carrier enrollment kits, and your book of business is everywhere. So you got to get it all in one place, centralized, and this is the way to do it. So that way you can get prepared for AEP and really have the most successful AEP that you've ever had. I think if you follow the guidance and do what Spark is doing right now, you're going to have the best AEP that you've ever had. I promise you that. But let's move over to the savings here on this. And we got an email from Miss Gale Lawrence, who was kind enough to share some feedback. She sent me an email and she said, this is how much I'm going to save by having Spark mail my customers. I've attached a copy of the letter that I normally send out. Now that time will be spent setting up other events. So she was spending time putting together a letter, creating that letter, updating the letter, getting it sent to the print house. They print it, stuff mail, and all that. She's doing it for about 700 clients, okay? So I asked Miss Gale if it's okay if I share this with you guys, because I thought this was really insightful, okay? So she broke it down and she said, I thought this might be interesting to you. And it definitely is, because this is a huge cost saver for her, not on just like the financial side, but also on the time saving side. So 700 letters she sends to the print house at 25 cents each. That's getting her for 175 bucks. 2 reams of paper, that's 90 bucks. She's got 700 envelopes, $42. 700 stamps, 420 bucks. She usually pays 3 admins to do this. So she was actually doing this internally. 3 admins, takes her 2 days, 15 hours, 360 hours of work there. She's paying them $1,000, $1,080. So her total cost on everything was over $1,800 to do her mailer. Which is a little expensive. We probably could have helped her out on the printing costs, but she's very hands-on. She likes to do it herself. Got it. But now everything's done for her. Everything's done, and mailed, right? And there's no cost to her. All right. Now, even better, and this is a part that we didn't talk about with Gale, is as these members are coming back and contacting or going into the CRM system and updating their information, she's now going to have fresher information than she's ever had before. And I know what it's like to send out letters and postcards and they get sent back because we didn't have the right information. They didn't tell us that they moved. They didn't tell, nobody called them and said, hey, I passed away. Those are unfortunate things that happen. But I think the first part is getting that mail out there to your clients. And then the second part is cleaning up that data. And I know some of you do it as you go, but some of you just don't take that extra TLC to clean up your data. It's a lot of work. I get it, right? But imagine your client's going to clean up their own data. Isn't that awesome? And they can do it 2 ways. They can, go on the website, they scan the postcard and they go on the website and they fill out the information themselves, or they can call the number and a team member at Spark will do that for you and update your CRM for you. And this is really impactful because I know a lot of you don't have records. You have a record of their information on the application, but it's rare to see an agent that has a record of all the medications and all the doctors that that member sees. You might have the primary care doctor because that's on the app, but do you have their cardiologist, their diabetes doctor, what gym they're going to, what meds they're on? That's huge information. Huge information. So thank you, Gail, for allowing me to share this with the team, because if you are doing your own mailers, it's not just the cost that's getting you, it's also the time that you're spending. So this is time that you could be spending setting up seminars, sales seminars, educational seminars, doing tabletops, going out and talking to the doctors, whatever that looks like. Your time will be better spent. Okay. So take some time this week to go through the gold key. All of you should have the gold key. And if you don't, I have a surprise for you today. We have simplified the link to the gold key. It is now joinhpm.com/gold key, all one word. And when you click that, that should take you right to our gold key. So you don't have to remember this long URL here. So if you forget, okay, yeah, it's probably in the gold key, joinhpm.com/gold key, and that will take you right to the gold key. Okay, easy peasy. So I hope everyone has got this information, because this is really where we're going to be storing everything that you need, especially with the call recordings. No updates on that, by the way. It's still a requirement, and we'll still have guidance. I may even do a webinar later down the road, just to keep everybody up to date on what's going on. So with that, I think we had a question here in the chat. Let me see. Linda says, I'm having an event tomorrow. Sergio's aware. Do I need to fill out the event form? Yes, please do. If you haven't filled out the event form, that's in that gold key there under events. So I'm going to show you how to get to it. So you're in your gold key, go to events, and then right at the top there it says file your Medicare events. You can click that, and you can get there and file that event, and we'll get it filed for you. And just for simplicity, Miss Linda, I'm going to go ahead and put that in the chat as well. So go ahead and click that link and fill that out. And again, it's because we need to get this over to CMS and make sure that everything's filed for them. Sergio may have done it, but he normally would tell you. So if you haven't heard from him on that, go ahead and just fill that out for the event, so we can make sure that you're covered on that. So great question. Okay, guys, we are at about 9:30. Thank you guys for being on the call this morning and listening to my wonderful rambles here. I do appreciate it. And just remember that these calls are being recorded. So if you need to reference it back, you can go ahead and visit our YouTube. Just type in Health Plan Markets and you'll find us out there. I hope everyone has a fantastic week. Go get your certifications done. Go to those rollout sessions. Study those first looks and get in that learning center so you can help your clients have a wonderful life, because you are improving it with affordable healthcare. Thank you guys. Have a wonderful